You're listening to Vet Candy.
Okay, welcome to another episode of Vet Candy Rounds with the Hawleys. My name is Dr. Quincy Hawley.
And I'm Dr. Tierra Hawley.
We'll be right back with more Vet Candy.
This show is brought to you by Merck Animal Health, makers of Nobivac vaccines.
Dogs' lives are unique. Their protection should be too. That's why you should choose Nobivac vaccines for one-of-a-kind protection for every kind of lifestyle. Choose the best. Choose Nobivac vaccines.
We're really excited about today's show. We've actually got a really special guest, and her name is Dr. Carey Hemmelgarn, and she's got a really cool case for us today.
Yeah, and she is actually married to medicine just like we are, right?
What do you mean by that?
As in, she has a spouse who's a veterinarian as well.
So she's like literally married to veterinary medicine, and then she's also married to a veterinary professional,
yes,
which is really cool, which probably has its challenges at times. You and I used to work in the same hospital, and it was kind of weird, but...
It was weird, but it worked for us. But, maybe it doesn't work for everyone. It comes with its own set of challenges, but
right.
Definitely worth it.
And so I'm curious to hear what Dr. Carey Hemmelgarn has to say about being married to another veterinarian. And I can't wait to hear about the actual case that she's got for us today, which is the major point of the show, of course, right?
Absolutely.
Thank you so much for having me today.
So, Carey, what do you think about being married to medicine? Can you tell us a little bit about that?
I think the question's a little bit harder for him. I think it's much harder to be married to an emergency and critical care veterinarian than me being married to him. He's on a different aspect of veterinary medicine. So he does lab animal medicine at a local university. So his life is a little bit easier than being an emergency and critical care specialist, but he is very supportive of everything.
For us, we met in undergrad and we started dating and then ended up going to 2 separate vet schools and got married right after we finished. How did you and your husband meet?
I did. I met him while he was getting his PhD at the veterinary school that I was at, which is Washington State. So I was a vet student and he was actually getting his PhD in neuroscience at the same time. So very interesting.
Wow. That's really cool because Dr. Tierra and I, we actually did a 3-month summer internship at Washington State University. So
that's right.
We love the Palouse, we love Pullman, Washington. It was really awesome to have that experience. And I think that, what were you doing? You were doing some type of research, right?
Yeah, I was working in the oncology department doing oncology research. And with Dr. Jeff Bryan, I don't know if you remember him, but a very, very awesome clinician there.
Right.
Well. And
I was doing some type of really cool research with Dr. Devendra Shah, and we were doing something with Salmonella enteritidis phage type 4, where I would go into this poultry facility and do swabs and determine like the pathogenicity of different strains of Salmonella. So that was pretty cool. But my favorite part of being in Washington State and doing that internship experience was the road trip that we took. And basically, if we can tell that story, we will. But for right now, we want to talk about Vet Candy Rounds. And on Vet Candy Rounds, we like to take a really cool case, almost like we were back in veterinary school again, and have the expert, in this case you, Dr. Carey, to walk us through the case, tell us a little bit about the history. We'll walk into some of the clinical signs, and maybe Dr. Tierra and I will ask you some questions about the case, and we'll just kind of work through it that way. And at the end, we will have a diagnosis and maybe a treatment and a case outcome. How's that sound to you, Dr. Tierra.
Yeah, let's get into it. I'm looking forward to it.
Okay, perfect.
Definitely. So what I'm going to do is I'm going to start the same as we did when we were in vet school. So we're going to start as we always do for rounds. So we're going to give everyone a good idea of what a signalment is of our patient, and then we're going to walk through some of the diagnostics and what led us to the final diagnosis. So today we're going to be talking about Sally. Sally is a 4-year-old female spayed mixed breed dog. I would say if I had to choose one breed more over the other, she does seem like she's got a hound mix to her. So she presented through the emergency room for what was described as having seizure episodes. And I'll further characterize that she presented to the emergency room in the Northeast US. She was previously healthy. She had no major medical health problems. And she presented to the emergency room with a history from the owners that she, over the past couple of days prior to presentation, had had a few seizure-like activities.
Okay, so can you describe those seizures to us? Because it's been my experience that sometimes the owner maybe will think that the pet's having a seizure, and it could be something else, right? It could be a cardiac event, or it could be something else other than a seizure. So with these, like Grand Mal, tonic-clonic, cluster seizures, what was the duration, frequency, things like that?
Yeah, that's an excellent question. So one of the things that I always think is useful, especially for any pet that presents to the emergency room or even to a general practice with a description of having something that's described as a seizure, is I think it's very important to get an idea of what those seizures are, because what to a layperson is described as a seizure may not be actually a seizure. So I think it's incredibly helpful to try to get a little bit more information from owners and to ask very pointed questions to try to get the best idea of what's going on with them. So the owners described the pet as falling over on her side, having tonic-clonic motions, sometimes urinating, sometimes not always urinating, and then popping up almost like herself shortly after the episode. And that happened a few times over the few days of presentation before she arrived. So what we normally describe for an animal that has seizures is something what we would call the Grand Mal Seizure, which is going to be for them to fall on their side, have tonic-clonic motions, sometimes urinate, defecate, unconscious, and take a little bit of time during their postictal phase to get back to their normal self. So the fact that they told me right away that she had bounced back and seemed to be more like herself right away put a little bit of a red flag that maybe we weren't quite dealing with exactly what they were describing as a seizure. But I always think it's more important to get a little bit more information, because there are different types of seizures in different presentations. And one of the things that I find pets will present to the emergency room for a lot is saying they have a seizure, but they're actually a pet having a vestibular crisis. So I think always getting information is important just to give us a little better idea of whether this truly falls into a seizure category.
So at this time where this pet was showing these symptoms, were there any other pets in the household that were sick as well? And also, what type of preventative care history did this pet have?
No other animals are sick in the house. They live with one other dog. No previous medical history, no current medications besides the fact that they are on flea, tick, and heartworm preventative, although the owners do describe they don't always give it. And they do describe that the dog has a very active lifestyle. She goes out hiking with them a lot. They've got a big backyard that opens up into some woods. And sometimes she even spends some time staring out into the backyard where there's deer and other wildlife that she gets to watch, and she loves it.
Yeah, so at the time, did you run any type of diagnostic testing? You know, I'm thinking blood work, like 4DX, heartworm snap test, even a fecal testing.
And whenever a dog's acting abnormal, for me, I want to see the internal organ function screen or the blood chemistry, as well as a CBC to look for those white blood cell counts. If there's infection, inflammation, something like that, as well as the red blood cell and platelet counts as well.
Including like a blood smear. You always want to check that as well.
Okay, that's getting fancy on me. Okay, with your blood smear. What tests did you all do?
The next steps that I recommended is doing some baseline blood work to try to give us a little better idea if there was anything metabolically causing these signs. So the things I was mainly looking for is I wanted to make sure that she had a normal red blood cell count, white blood cell count, a normal platelet count. So we ran a CBC and we ran a chemistry panel. So those were running at the same time. On the chemistry panel, I wanted to see if her blood glucose was normal, make sure that this wasn't an episode secondary to low blood sugar, that her liver, her kidney values, her electrolytes, I wanted to make sure all of those things were normal. And so that's where I initially started, was doing some baseline blood work, was with a CBC and a chemistry panel.
So what were the results of that testing?
So she had a mild stress leukogram, but otherwise her blood work was normal.
Okay, so I understand we had a stress leukogram. Were there any other tests that you did? One thing that I would think about would be like a urinalysis.
I did not do a urinalysis. That was one of the next things that we had talked about. But first I wanted to get her upstairs, and I wanted to take a good look at her. So one of the first things that I wanted to do on my physical exam is that I wanted to look at her and see if there was anything from our first different diagnostic that we should use, which is our physical exam. So I wanted to make sure that neurologically she seemed normal. So we checked her cranial nerves. Those all seemed normal. We checked her lymph nodes. Those all felt normal. I listened to her heart, her lungs, palpated her femoral pulses, felt her abdomen. And there was a big abnormality that I found on my physical exam, and that was that I auscultated an arrhythmia when I listened to her.
Fairly unremarkable, right?
Mm-hmm.
So
Yeah.
just an arrhythmia that I probably would have missed unless it was like a rip-roaring something. Absolutely crazy. So are there any other things that are abnormal?
Besides seeming a little bit weak over the past couple of days with these seizure episodes, otherwise she was otherwise acting normal. She was eating. She had not had any vomiting or diarrhea.
Okay, so we were thinking seizures earlier, but we weren't 100% sure. Did you ever confirm that they were actually seizures based off of the information? Because as I mentioned earlier, and as I think you're kind of alluding to, like it could be like a cardiac or something like a syncopal event as well, even though it does kind of sound like a seizure to me. But so yeah. Any more information on that?
It sounds like from the information I could get from them that maybe it wasn't what we would consider a Grand Mal seizure. And I was more worried that potentially she was having a syncopal episode and that maybe these arrhythmias were related to what was causing her to have these episodes.
Okay, so basically at this point, we're thinking it could be some cardiac disease, right? As Dr. Tierra mentioned. And what are some of the things that we would consider doing? I know for me personally, maybe some type of heart testing or imaging would be a good idea. And so I think you mentioned ultrasound or echo, right?
Echo.
And there's also, thoracic radiographs. And since we're thinking like an arrhythmia, maybe even an EKG would be a good thing to do. But for Dr. Quincy Hawley, kind of like in human medicine, right? If you go in with heart palpitations to a general practitioner, you're going to be like, get out of here and go see a heart specialist, go to a cardiologist. And that's my style of medicine right there. If it's available, and since I'm right here in North Carolina, take your butt to NC State to get out of here. So Dr. Carey or Dr. Tierra, go ahead.
There is nothing wrong with referring a patient. I will do it so quickly
Right,
if
right.
I don't know what's going on.
And so Dr. Carey, did you consider anything like that?
Yeah, that's awesome. That's definitely the next steps that we took for Sally. So I had my technicians put an ECG lead on her, and I started to notice that she had an AV block, and she had third-degree AV block. So now I was immediately wanting to try to find our cardiologist to see what our next steps were, and that hopefully he was hoping that he didn't have to stay for a 5 p.m. pacemaker placement.
So when you spoke to the cardiologist, what did they recommend?
So the cardiologist recommended for us to go down the road of finishing our baseline panel on our pet. And he had asked if I had checked her for heartworm disease. And then I regretted, definitely should have checked her for heartworm disease before I called the cardiologist over. So we ran our in-house ELISA test for our 40X. And weirdly, we did not find that she was positive for heartworm disease, but we did find that she was positive for something else on our 40X.
And with some of the signs that we've been seeing, I'm going to go out on a limb and say Lyme disease is probably what we're testing positive for. Is that right?
Lyme disease.
That's right. And we're thinking that because
the pet's environment, being a dog that spends a lot of time outdoors and there's deer often in the area, it makes a lot of sense.
Because, of course, the Lyme disease coming from the deer tick, right?
Yes.
Yeah.
And so I circled back with the owners and I asked if there was any chance that Sally had recently had any ticks on her or whether they'd removed any ticks, which regretfully, maybe I should have asked that sooner in my history. And they had described that about 2 months ago, she had gone hiking with them and that a few days later, they knew that she had multiple engorged ticks on her and they had realized that they'd forgotten to put her heartworm preventative on, they'd forgotten to put her flea and tick preventative on for the past couple of months.
Yeah, I remember you said that at the beginning in the history that there were sometimes lapses in the flea and tick and heartworm preventative. So it's why it's so important, right, to keep that preventative monthly, or if you're using something like Bravecto, which is every 3 months. But to stay on track with all of that, it's so important.
Did you assume at this point that the Lyme disease was the underlying cause behind the symptoms that the pet was showing, such as the myocarditis as well as the syncopal episodes?
Right. And what did the cardiologist say?
Yeah, so the next steps we did is we did an echocardiogram, and thankfully he didn't find any structural damage in the heart. And so really the only way that we can further diagnose Lyme disease myocarditis is by doing a biopsy and looking for the actual Borrelia within the cardiac muscle, which we did not do for Sally. But what he had recommended was for us to start treating her as if this could be secondary to Lyme disease and seeing if we saw a positive response, which we'd want to see a response in her clinical signs within the next 2 to 3 days. And that if we were not seeing a response, then we needed to go down the road of looking for other causes for her to be having this heart block and potentially looking further into a pacemaker placement. But thankfully, Sally responded to treatment and her AV block completely resolved with treatment.
I was so excited to hear that we got the diagnosis for Sally and were able to treat her, right? And resolve those syncopal episodes and the AV block. Like that's really fantastic. But Dr. Tierra, this doesn't sound like our typical Lyme disease case. Like me personally as a vet, if a dog's coming in with heart disease, like Lyme's not on my differential diagnosis list.
It's not on my list at all. I think about, polyarthritis, of course, and maybe the pet is urinating more, and
like Lyme nephritis or something like that, or even an elevated temperature. We didn't even have that, you know.
A fever.
So
it makes sense though, because I understand, like with Lyme disease, it is not necessarily the bacteria that's causing the issue. It's the body's immune system that is attacking everywhere that bacteria is going. So if it's the joints, if it's the brain, if it's the heart, you're going to expect to have some type of clinical signs associated with that.
Right, exactly. And as we used to say back in vet school, like, it sounds like this disease didn't read the book, right? This case of Lyme disease just didn't read the book. And it's important for us as clinicians to remember that sometimes you can have these atypical representations of certain diseases.
Yeah, so Lyme disease wasn't even on our radar, but I think it's really interesting because Lyme disease, while we normally expect for us to see Lyme arthritis or Lyme nephritis, we can see lots of other types of inflammatory conditions with Lyme disease, including things like myocarditis, but we can also see myositis, and we can see perineuritis or inflammation around nerves. And so, unfortunately, Lyme disease can look like a lot of different diseases, and that it's always important to make sure that we're ruling out those things as we're looking for other diseases.
So because you live in New Jersey, you must get a lot of Lyme disease cases. I know it's endemic here as well, but I haven't treated very many Lyme cases here, even in North Carolina.
Yeah, we see some like faint positives on the 40X from time to time, and typically we'll go ahead and treat that pet, especially if it has some clinical signs. But yeah, you must see that quite often, I imagine. Is that right?
Yeah, absolutely. So it's always on our radar if we see a pet that comes in that has an elevated temperature or swollen joints or shifting leg lameness. Those are all things that would have immediately popped up. But this was such a weird presentation. It wasn't something that was immediately on our first line of differentials.
And so did you have to give any medications or treatment for the arrhythmia and the heart disease?
We didn't. They responded, and her arrhythmia was back to being almost normal within the first couple of days of treatment. And then by the end of her course of antibiotics, it had completely resolved.
Yeah. And so again, like this is it's an atypical case, right? Where we have something that looks like neurologic signs. And I think that Sally was just lucky to make it to your clinic, right?
Absolutely.
Absolutely. Yeah. Yeah, we were all rooting for her.
So at this point, is the owner now using a flea and tick preventative consistently?
Right. And has the lifestyle changed? Are they considering moving across country so somewhere where there are no deer ticks, or did they just beef up their ectoparasite control?
Absolutely, especially because she has another dog at home. And so we talked at length about prevention, which is, again, being very, very diligent about flea and tick preventative, making sure that we're giving it on the same time of every month and that we're not skipping dosages, even if it necessarily is in the winter, but being really on that schedule of always making sure they're giving the preventative. Changing environmental things. So after they take her hiking or after they take other pets hiking, making sure they're checking for any ticks, making sure they're being very diligent about making sure there aren't any ticks attached. And lastly, we talked to them about considering vaccination for Lyme disease because they are living in an area where it is an endemic and there is a very high tick burden. And so it is something, especially with these dogs living an active lifestyle, this is definitely, they are candidates for the Lyme vaccine, and it could be very useful in helping them prevent this happening again in Sally, because unfortunately dogs can be reinfected with Lyme disease, but also we want to prevent their other pet from going through this or any future pets.
Wow. So definitely thank you for sharing that information. You know, I'd say personally, I've learned a lot from your case, you know, as a practicing veterinarian, just knowing that there may be some other things that I should start to pay attention to when it comes to pets that may or may not have Lyme disease. And those are definitely some really good, helpful tips for owners, you know, making sure you're checking your dog for ticks when you're coming home from hiking, and keeping your pet vaccinated if you are in an endemic area, as well as if your pet has that lifestyle risk of possibly contracting Lyme disease.
Right. Yeah, I think that's the big thing. And then for our veterinarian listeners, right? I think it's really important to keep in mind that certain diseases don't always have to be in certain locations. I think that the deer tick, aka the black-legged tick, is spreading across the nation. So it's coming on down here in North Carolina. I know we've had it for a while now, but I've even heard talks about this tick starting to spread more western. And so even if you're a veterinarian in different areas where you haven't historically had the deer tick, just to be cognizant that, hey, if you're starting to see some of the signs that we've talked about here today, or even some of the more classic signs, that maybe you need to have Lyme disease on your differential diagnosis. Yeah. And just one more thing before we close out the show is remembering that, in my opinion, that humans can also get Lyme disease, right? And so if your dog gets it, to make sure that you check yourself as a human even, right? If you had a target lesion, or if you've been having some arthritis or something like that, maybe to consider letting your physician know that, you know, your dog had Lyme disease, and I don't know how humans get tested for Lyme disease, but consider doing that for yourself is one other thing that I would add to my recommendations for an owner who had a dog with Lyme disease. Yeah. But with that being said, thank you so much for coming and spending this time with us here today on Vet Candy Rounds, where we like to take a really cool or atypical case, a mystery case, if you will, and walk through it with an expert like yourself, Dr. Carey. So we really appreciate your time, and it's been fun.
It's definitely been fun. Dr. Carey, what would be the best way for our listeners to get in contact with you?
If they're interested in learning more, they can follow me at IntensiVets on social media.
Thank you so much, Dr. Carey, for sharing your social handle. And it sounds like they can follow you at IntensiVets on your different social channels. And we'll also put that information in the description of this video. And also make sure to follow us at My Vet Candy for more really cool and awesome information and content, podcasts, and all types of stuff. So we really appreciate all of our listeners, and we appreciate you, Dr. Tierra and Dr. Carey, for this show today.
And thank you so much for sharing this case with us today, Dr. Carey.
Thank you, Dr. Quincy and Dr. Tierra, for having me today.
Thank you for listening to Vet Candy Rounds with the Hawleys. If you like what you hear, then subscribe to this channel. You can also keep up with everything vet med by following at My Vet Candy. Thanks, everyone.
It's Vet Candy.
Vet Candy.
It's Vet Candy Radio.